Calcarea phosphorica, phosphate of lime, one of the most important tissue remedies, and while it has many symptoms in common with Calcarea carb, there are some differences in characteristics, features of its own. It is especially indicated in tardy detention and troubles incident to that period, bone disease, non-union of fractured bones, and the anaemias after acute diseases and chronic wasting diseases. Anemic children who are peevish, flabby, have cold extremities and feeble digestions. It has a special affinity where bones from any change of weather. Numbness and crawling are characteristic sensations, and tendency to perspiration and glandular enlargements are symptoms it shares with the carbonate. Scrophulosis, chlorosis, and phthisis. Don't know what it is. Mind peevish, forgetful, after grieving and vexation. Ignatia and Phos active. Always wants to go somewhere. Headache worse near the region of the sutures from change of weather. Of school children about puberty. Fontanelles remaining open too long with abdominal flagellants. Head hot with smarting of roots and hair. Diffuse opacity in cornea following abscess. Mouth. Swollen tonsils, cannot open mouth without pain. Complaints during teething. Teeth developed slowly. Rapid decay of teeth. Adenoid growths. Stomach. Infant wants to nurse all the time and vomits easily. Craving for bacon, ham, salted or smoked meats. Much flatulence. Great hunger with thirst. Flatulence. Temporarily relieved by sour irritations. Heartburn. Easy vomiting in children. Abdomen. At every attempt to eat, colicky pain in abdomen. Sunken and flabby. Colic. Soreness. Burning around navel. Stool. Bleeding after hard stool. Diarrhea from juicy fruits or cider. During detention. Green. Slimy. Hot. Sputtering. Undigested and fetid flatus. Fistula in ano. Alternating with chest symptoms. Urine. Increased with sensation of weakness. Pain in region of kidneys when lifting or blowing the nose. Female. Menses too early, excessive, and bright in girls. If late, blood is dark. Sometimes first bright, then dark, with violent backache. During lactation with sexual excitement. Nymphomania with aching, pressing, or weakness in uterine region. After prolonged nursing, leucorrhea, like white of egg. Worst morning. Child refuses breast, milk taste salty. Prolapsus in debilitated persons. Respiratory, involuntary sighing, chest sore, suffocative cough, better lying down, hoarseness, pain through lower left lung. Neck and back, rheumatic pain from drought of air, with stiffness and dullness of head, soreness and sacroiliac symphysis, as if broken. Extremities, stiffness and pain, with cold, numb feeling, worse any change of weather, crawling and coldness, buttocks, back, limbs asleep. Pains in joints and bones, weary with when going upstairs. Relationship, complementary, ruta and Hepper salt, maybe not salt, just Hepper. Compare Calcarea hypophosphorusa. It is to be preferred when it seems necessary to furnish the organism with liberal doses of phosphorus, in consequence of continued abscess having reduced the vitality. Give first and second decimal trids. Loss of appetite, rapid debility, night sweats, acne pustulosa. Pallor of skin, habitually cold extremities. Phthisis, diarrhea and cough, acute pains in chest, mesenteric tuberculosis, bleeding from lungs, angina pectoris, asthma, affection of arteries, veins stand out like whipcords, attacks of pain occurring 2 hours after meals, relieved by a cup of milk or light food, caranthus, effects of cutting wisdom teeth, Calcarea renalis, lapis renalis, arthritic nosodes, Riggs disease, lessens tendency to accumulate of tartar on teeth, lessens tendency to accumulation of tartar on teeth, gravel and renal calculi, conchyolin, mater perlarum, mother of pearl, phthisis, has a wide range of action in bone affections, especially when the growing ends are affected. Petechia, silica, sorin, sulf. Modalities: worse, exposure to damp, cold weather, melting snow, better in summer, warm, dry atmosphere. Dose: first to third titration. Higher potency is often more effective.